Okay, so I have the privilege of talking to you about what happens to the cardiac patient once they leave El Camino. And I wish my staff would come up, but I have a wonderful group that works with me. I could definitely not do this alone. And our program started in 1994. It was pretty small, and it's grown to a very robust program. We are the only nationally certified program in the Bay Area. And I think we do a tremendous job, and we do really live by the wellness. So Josh came to my office earlier in the week, and he said, "You do such amazing things with our cardiac patients. You have 5 minutes on the agenda." I said, "I can name that tune in 5 minutes." So here's my 5-minute infomercial on cardiac rehab. So once the patient's discharged from the hospital, they get a call from us anywhere from 2 to 8 weeks after they've been discharged, depending on what their diagnosis is. And I will give a shout out to all the wonderful cardiovascular doctors that we have, our cardiologists. They really believe in our program, and they really support it, and they really promote their patients to come to cardiac rehab. I wish it was mandatory for everybody, but it's actually not. It's a voluntary choice. But the ones that come through really do benefit from the program. So we do an individualized intake on them when they first come to our department, depending on what their diagnosis is, what their barriers are, what their goals might be, and we set up an individualized treatment plan for them. We really individualize it to the patient because we're all different. We all have different goals. My recipe card is going to be different than your recipe card, than your recipe card. So we really find out what the patient wants specifically. So once they come to us, they spend 12 weeks with us. The first part of it is we teach them about exercise, the importance of regular exercise. We also incorporate strength training, and we also incorporate balance. And it's really about exercising smarter, not just about harder. They also get a comprehensive nutritional program. We are privileged to have a full-time dietitian, and they can meet with Sherry as often as they'd like. And then they touched on it a little bit today, but we do a comprehensive stress management program as well. We know stress is a big risk factor in cardiovascular disease. It causes inflammation, and we spend time teaching them about mindful meditation. We talk about self-care. We talk about their stories. They tell their stories to each other, and it's a very personal time for that. And then we also throw in a little bit of laughter yoga because we all know it's important to laugh, right? And then we have other risk reduction lectures on exercise physiology. We go through medications. We also talk about cholesterol, and we also talk about prediabetes. There's a lot of people that don't realize that their A1C is in that range of almost going over the edge. So if we can prevent them from getting to the diabetes phase, that's always a plus. And so once they graduate, we hope we've instilled with them the tools that they need, because it's not just what they do with us in the 12 weeks, but how are they going to carry this journey on, and how are they going to continue to lead that wellness that we've all been talking about. So I encourage all of you guys, with all the information that you got today, is set a realistic SMART goal, something that's achievable. It doesn't have to be big. I always tell my patients, it's about progress, not perfection. Remember that. It's progress, not perfection. It's also being proactive and not reactive. So with that, you're going to see a pretty moving video of a former patient of mine. He never thought that cardiac rehab was going to be on his bucket list, but he really embraced his time with us, and he is still living his wellness journey, and I think you guys will find this pretty compelling. So thank you.
I guess I was that guy. It can't happen to me. I work out. I thought I ate good. And I was doing some open water swimming in a lake in the East Bay. And I was going across, and I would have to stop 2 or 3 times. But I attributed that to old age. But in reality, it was one of my arteries that was clogged and the blood wasn't flowing to the heart. My health to me means everything, because I do a lot of physical stuff with my body. Ride my bicycle quite a bit. I hike. I work out 5 to 6 times a week. I had chest pains They progressed, they got worse and worse, and I just didn't feel right. It turned out I was having a widowmaker heart attack. But I didn't know all this until I showed up to El Camino Health. I was put on a gurney, and then I knew it was very serious. Dr. Aga came in. He was very reassuring, and so were the nurses. I just sit back, let them do their thing, and when they were done with the surgery and the stent was in place, I was feeling great, and I was feeling like nothing had even ever happened. On the first follow-up with Dr. Aga, he put a plan in place, and the plan that they made for me, it was catered to me, and I knew that I was getting the best care anywhere, and my recovery, based on what the information they gave me to take home on my diet and my exercise, was very instrumental to getting back to 100% in a shorter time. And I felt like I was appreciated and was part of their healthcare family. Working with El Camino Health, they've gotten me back up to that level where I can make an impact on people's lives and the community as a whole around me. If I can bring some hope or some care in people's lives, I'm all about it. I like doing that. If you're not feeling yourself, don't hesitate. Seek help. Go to El Camino Health because they're there to help. I trusted El Camino Health with my heart, and they helped rebuild my life.
Well, we are so grateful for all of you today being with us. As we get ready to close the program, we just want to make sure that we express all of the gratitude and thanks that we have for everyone that was a part of this. How about our amazing speakers today? Huh? These dedicated physicians and care providers giving up a Saturday, and it's so beautiful out there. That's why we kept the windows closed, by the way. No, but it's such a hard day. But they came, and really a labor of love. Many times doctors, they say they're kind of burning out. Our doctors, their passion, it just really is impressive to be a part of that. And we'd also like to thank all of the volunteers. I forget how many total number of volunteers we have, but it's a lot of volunteers. We want to give them a round of applause? Okay. Woo! Yeah, they were here early in the morning setting up. They were here last night, some setting up. And we'd also, how do we like our young guys doing the microphones today? Just want to give them a shout out.
Good job. Good job.
Yes. And a very special thank you to the Hospital Foundation organization. They support us in so many ways here at El Camino. There's many things we couldn't do without their support. All right. And then we have the best crew in show business without Brian Richards, Edit One, Bill, John, Greg, everyone, just awesome. Thank you.
So it's seamless. We didn't even notice them, and that's a success of a good production. Well done.
Yeah, our marketing team, oh my goodness, they did so much work. Marketing, thank you. How did we like the hospital catering today?
Woo! Go Chef Jock.
Yes. Lisa Janikowski, our events coordinator. Beautiful job. Thank you, Lisa, so much. But the one that's nearest and dearest is Donna Marholta Garcia. Donna, woo! She made, this wouldn't happen without her. We'd like to thank all of our health programs, the community partners that were with us today, and also the industry innovation partners. They volunteered their time to be here as well. So we're so grateful to have them here.
So people say it takes a village. I say this took a city to do.
We did, yeah, a city, and it's going to become a blue zone. That's what we remember. Okay, all right.
Goal.
And then we'd like to, of course, thank you all for you're taking your time and you're investing this in your schedule. Remember what our goal was today. We want to empower you. We hope we have informed you. But we also hope that we've encouraged you and that we've given you a little motivation to take this and make your life better. So we'd like to, thank you.
Wait. Wait. And again, as I rest my case, as I said earlier, Josh, you're not easy to follow. But we're not done yet.
Oh, yeah, that's right. Sorry.
What did we talk about doing earlier? We have some work. We did some work. What are the 3 tips? Right.
Oh,
What are
the
the
test,
3
the
tips?
test.
This is a test. No, don't put them up on the screen. What was the first one? Out of your comfort zone.
Yeah.
Exactly. Out of your comfort zone. Do that. Think about that. And what was the second one? Pardon me? Life. Exactly. Lifestyle. Just add into your daily routine activity, movement. Make it fun. Keep moving.
moving.
Exactly. And finally, the simple one, but also very tasty. Exercise snacks. We did a lot of snacking this morning. We had a good lunch, but we also did a lot of snacking before it. Keep doing those 3 things. So you guys you've really been drinking from the fire hose here for the last couple hours, right?
Yeah.
And I apologize, but I hope a lot of things that we said really resonate with you, will sink in, and that you're going to go home and think about them. Because, as I said earlier, there's so many things that we can do in a proactive way to make such a difference in our overall health. And I really, truly, truly hope that we have helped, as you so kindly said, empowering your hearts for lifelong wellness. So thank you very much.